Hey everyone, it's Dr. Jess. Welcome back to my channel. In today's video, we're going to discuss rate of flow of IV fluids. We'll learn how to calculate rate of flow in milliliter per minute, drops per minute, and also calculate the quantity of drug in an IV infusion. If you're new to my channel, please take a moment to like the video, subscribe to my channel, and turn on your notification bell so you don't miss out on any new uploaded video. All right, let's get started. Rate of flow is usually expressed in milliliter per minute or drops per minute. Here I have an equation that can be very useful when doing rate of flow calculations. It is rate of flow in drops per minute equal volume infused in ml times the drip set in drops per ml divided by the time in minute. Now, this is just one equation, just one way to perform those calculations. Now, we'll do actual practice problems, and when doing those problems, I'll show you multiple ways that you can use to perform rate of flow calculations. And then you can choose whichever way works best for you. Let's look at this problem. A medication order calls for 1000 ml of D5W to be administered over an 8-hour period. Using an IV administration set that delivers 10 drops per ml, how many drops per minute should be delivered to the patient? Okay, so for this problem, I'll show you 3 different ways to solve it. Let's look at this problem closely. So what are we given? So we're given 1000 ml of D5W administered over an 8-hour period. So we'll need to convert the 8-hour to minute. So it's 8-hour times 60, that's 480 minutes. So that means it's 1000 ml over 480 minutes. So 1000 divided by 480, that gives us 2.08 ml per minute. So that's the rate in ml per minute. We're also given the drip set, which is 10 drops per ml. So now if we have the rate of flow in milliliter per minute and we have the drip set, so then we can just do 2.08 ml per minute times 10 drops per ml. The ml cancel out. Then we have our final answer, which is 21 drops per minute. Now, let's look at a second way that we can solve this. We can use dimensional analysis to solve this problem. And if you need to learn more about dimensional analysis, I'll leave the description for that, the link for that video in the description box. So, to use dimensional analysis, remember, we'll set everything up in such a way that the unwanted units cancel out. So 10 drops per ml. So we want our final answer in drops per minute. That means 10 drops per ml, 10 drops should be on top, 10 drops per ml. Then we have 1000 ml over 8 hours. Remember, it was 1000 ml of D5W over an 8-hour period. Times conversion unit for the time, 1 hour over 60 minutes. If we look here, all the 2 mLs cancel out, the 2 hour cancel out, then we have drops per minute left, and it's 21 drops per minute. So same answer. Lastly, we can use that equation that I talked about, which is rate of flow in drops per minute is the volume infused, in this case 1000 ml, times the drip set, in this case 10 drops per ml, divided by the time in minute, in this case 480 minutes. And what's the answer? Anyone wants to take a guess? That's correct, 21 drops per minute. So as you can see, you can use any of these methods to do those calculations. Okay, let's look at another example. A physician's order calls for 400 milligrams of clindamycin to be added to 600 ml of D5W for IV infusion over 90 minutes. Clindamycin is available as an injection containing 600 milligram per 4 ml. Questions: how many ml of clindamycin injection should be used? 2. How many milligram per ml of clindamycin will the infusion contain? 3. How many ml per minute of the infusion should be delivered? Okay, so it's a three-part problem. So we're asked three questions. So let's look at this closely. So first question is, how many ml of clindamycin injection should be used? So what are we given? So we know that 400 milligrams of clindamycin is going to be added to the 600 ml of the D5W. But the clindamycin is available as an injection of 600 milligram per 4 ml. So if clindamycin is available as 600 milligram per 4 ml, we can kind of use ratio and proportion here. So 600 milligram over 4 ml, then 400 milligram is X. So we'll do X equal 4 times 400 divided by 600. So then the milliliter of clindamycin is 2.67 ml. Now, the second question is, how many milligram per ml of clindamycin will the infusion contain? So here they're asking us how much clindamycin is in the infusion. That's pretty much what's being asked. So we know we have 400 milligram of clindamycin. Now, what is the total volume of the infusion? We know we have 600 ml of D5W, but remember, the total infusion has the D5W plus the clindamycin. So the majority of the volume will be the D5W, which is 600. But remember, the clindamycin also has a little volume that we just calculated of 2.67 ml. So the total volume of the infusion is 600 plus 2.67 ml. That's 602.67 ml. That's the total volume of the infusion. Now, to calculate how much clindamycin in that infusion, then you'll have 400 milligram over 602.67. Does that make sense? Does it make sense why we're using 602 and not 600? So let me repeat. So here, the 600 is the volume of just the D5W. But the clindamycin also has a little volume. So we have to add them. And then when you put 400 milligram of clindamycin, that's going to be over the total volume of the infusion, because that's what we're being asked. How much clindamycin in the infusion? Okay. Now the third question is, how many ml per minute of the infusion should be delivered? So here they're asking us for the rate of flow in ml per minute. So we already know that the volume of the infusion, we already calculated that it's 602.67 ml. And how long is the infusion? We know the infusion is over 90 minutes. So it's already in minutes, so no conversion needed here. So then The rate here will be 602.67 divided by 90 minutes. And the final answer will be 6.7 ml per minute. Okay, so if you have any questions about anything that I've discussed today, you can leave me a comment, a question, and I'll answer you. That's it for today. I'll see you in the next one. Please don't forget to like and subscribe on your way out. Bye.